Dr. Tebeje, thank you very much for agreeing to speak to us. I wonder if we could start by you introducing yourself and your role within the African CDC.
Thank you for having me. My name is Enio Kabada, and I'm head of division for laboratory systems, and I've been also, acting head for surveillance for the last 1 year, and that's where I have been leading, the antimicrobial resistance program across the continent. So I have been at Africa CDC for 6 years.
6 years. What are the main priorities, just in terms of infectious diseases, what are the main priorities for the African CDC?
So we saw, Africa is suffering from a triple burden. One is, there is an increasing frequency of outbreaks for infectious diseases. Second is, there is malnutrition. And the third one is, there is also, a rise in non-communicable disease recently. So in terms of infectious diseases, last year alone, we have identified more than 185 public health events across Africa. These are emerging and re-emerging infectious diseases that require immediate intervention. And then, there are also, endemic diseases that are well known like TB, HIV, malaria. So the continent is really, being challenged, and the health sector is significantly strained because of those frequent disease outbreaks and also endemic diseases.
In terms of antimicrobial resistance, what do you think are the major challenges or priorities for Africa?
AMR, as you may know, it is a global emergency. It is a silent pandemic, and the magnitude is increasing every time. And if I take, specifically to Africa, it's a big issue for Africa. It's in fact, a threat for the health security and economic development for Africa. AMR, there are recent documentations that, the burden of AMR is greater than the impact of TB, HIV, and malaria combined. The mortality from AMR is one of the highest in Africa, and estimated at 27 deaths per 100,000 people. And the challenge is big because the interventions are not proportional to the magnitude of the issue. Many countries do have national action plans on AMR based on the UN recommendation. However, implementation is very, very slow. And we have also, the issue of political commitment, which is not really adequate. There are limitations in terms of financial resources to address the magnitude of AMR. And generally, the capacity to generate antimicrobial resistance data is also very limited because we have no really strong surveillance systems. And access to this basic clean water, sanitation and hygiene, the WASH, is a big issue in many countries in Africa. And laboratory systems are very, very poor, to detect antimicrobial resistance. In fact, one of our studies indicated that only 1.3% of the African laboratories can do microbiology testing. So it's a big challenge.
So you talked about the challenges, things like access, particularly on diagnostics and surveillance, which obviously relates to antibiotic usage and stewardship. What do you think are the solutions? What do you think of the way? What is the way forward?
The antimicrobial resistance, it's a complex problem. So really, there is no a single solution for it. So the solution is a multi-sectoral and multidisciplinary One Health approach. In the last 6 years, the Africa Union through Africa CDC, we have been implementing initiatives that are focusing, on improving surveillance. We see today, the data reported to WHO from Africa, that's a huge underestimation. Because, the data goes from either one reference lab or 1 or 2 sentinel regional labs. Second is we need to really implement some interventions that delay emergence of resistance. This includes antimicrobial stewardship and also guiding treatment of infectious diseases so that people appropriately prescribe the right antibiotics for that particular infection. And especially improving diagnostics will help a lot because most of prescriptions happen in community setting where you don't have diagnostic capability. So mostly antibiotics are prescribed for viral infections. And there is also a lot of self-medication happening. So I think those have to be addressed. Second is if antimicrobial resistance occurs, if it emerges, then we need to limit transmission. Limiting transmission is improving the standard of care in hospitals and healthcare settings. It's also appropriately implementing infection prevention measures and increasing access to these preventive things like the WASH program and so on. And the other one is we once infection occurs, and then we need to limit the harm. That's where the guidance for appropriate treatment of drug-resistant pathogens is very important. So working with clinicians and so on. And finally, we need to do more advocacy and engagement of the public to really understand the magnitude of the problem and make the public part of the solution for AMR.
So you've mentioned there access to diagnostics, access to appropriate antibiotics. You mentioned prevention in terms of infection control.
Yeah.
Prevention. And then you talked about public health, educating the public. In terms of education and educating physicians and nurses and other health professionals across Africa, is that a challenge? And is that quite varied? And how do you address that?
Yeah, it's a big challenge. One, because those issues are not brought during the pre-service education, and then people go into medical practice and they prescribe drugs in the absence of appropriate guidelines. That's one. Second is there are no really active education programs going on as part of continuous medical education and so on. And then the last one is generally the health infrastructure will not allow some of the health professionals to do appropriate infection prevention measures, like the cleanliness of the hospital facility and the health education and all those are really not strong and generally there's also issue of access to infection prevention materials and so on. Vaccination is a big problem because one important preventive measure of AMR is vaccination. Yeah. So, I think generally there is lack of resource, lack of dedication. There are no strong programs running, really, to engage healthcare workers to address the issue of AMR.
Thank you. Dr. Debeji, you know that September in New York, we have a UN high-level meeting on antimicrobial resistance. Mm-hmm. What would you like to see, speaking for the kind of Pan-African countries, what would you like to see come from that meeting?
Yeah. So I think we cannot address antimicrobial resistance without addressing the inequalities and inequities in terms of healthcare access, including access to quality antimicrobials. So all those high-level meetings and global targets and commitments should consider the unique challenge that Africa and other low and middle-income countries are facing. These are really lack of resources, it is also, lack of access to, basic things that we mentioned, like wash and antibiotics and, the infrastructure and so on. And also, lack of financial resources as well. There is a lot of really, high-level political commitment and so on, but that is not translated into allocation of appropriate resources to run programs that can really help to reduce antimicrobial resistance. So, and fortunately, this year, in preparation for the UN General Assembly, the African Union, with all its technical agencies and partners, we are leading a high-level political engagement so that the needs of Africa will be addressed during the UN General Assembly. So we will be going with a strong voice from Africa, articulating our needs, and also what we should think will be priority from the African context.
Well, of course, this is the idea of these sort of podcasts is to give Africa a voice, or enhanced voice as well. What would be your message to the UN General Assembly meeting? What would you like to tell them are the needs for Africa, like 3 priorities, for example?
Yeah. So I think AMR, as I said, it requires really, a global commitment, a political will, financial resources, accountability frameworks. So, like we did for other, global challenge, like the climate change, the maternal and child health, sustainable development goals, and so on. What I would like the UN is, we need to set a target for antimicrobial resistance, and then we set a target. We show political commitment, and then we create accountability frameworks, and then funding. So otherwise, you cannot measure a real progress on AMR unless you have a target that countries will buy into it and they are accountable for it. So one of our asks will be, let's establish a high-level global targets that countries will buy into, and then also establishing a monitoring framework as we do for SDGs and maternal and child health care and climate change and so on. And then that really gives us a platform where we can objectively determine, how we are progressing in terms of AMR control, across the globe.
Well, as you know, there's 17 SDGs, and I actually think 16 of them are actually related to antimicrobial resistance.
Yeah.
And in terms of targets, you mentioned the fact that there has to be palatable, and you have to have participation across all sovereign states to buy into this. What do you think those targets would look like? Do you think those targets should be necessarily on antibiotic usage, or maybe a reduction in mortality with appropriate use of antibiotics? What?
I think we can have combination of those. For example, you can put a target of reducing mortality from antimicrobial resistance, and then you can also set a target on the use of antimicrobials both in the in human medicine and also in the animal sector. And then you may also set a target for industries in terms of how we are progressing on research and development, coming up with new antibiotics and so on. I know that will be a little bit of hard target, but we can think of something like that.
And it has to be cost effective.
To
be implemented.
It has to be realistic and.
Yes. Do you think we should also have targets on diagnostics?
I think so. Yeah.
Yes.
In fact, that could be relatively simple. Huh?
Yes.
Access to diagnostics, that very, very, very important.
Dr. Beji, I think we've covered everything that we needed to. Thank you very much for your time.
Thank you.